never tell. Did somebody get well?
Hi, my name is Margie DiMonte, and welcome to my show, As A Fiddle Today. I'm very excited about this part of my show because I'm going to have two guest speakers on. Both of them will be talking about Lyme disease. The first one will be Arthur Gertler, who's a physician, and he will be on a phone interview. In the second part of my show, we will actually have Zach Orme with me talking about Lyme disease. So let's get our show on the road. Okay, so let's begin. I will be interviewing by phone Dr. Arthur Gertler from Darcy Wellness Clinic in Natick. He is a Lyme literate physician who has been practicing holistic medicine for many years. Dr. Gertler is board certified in both gastroenterology and internal medicine with 30 years of clinical experience. He joins us now by phone. Thank you, Dr. Gertler, for taking the time to share your expertise with us today. I'd like to begin by asking you some questions. If you could please explain to our audience, what are the signs and symptoms of Lyme disease?
Okay, the signs and symptoms of Lyme disease vary. Acute Lyme disease is different than chronic Lyme disease. Acute Lyme disease, when present, usually is manifest by fever, headache, neck pain, sometimes a little confusion, and sometimes pains in the joints. Occasionally people get meningitis or encephalitis, which has to be hospitalized. Chronic Lyme disease, which occurs after approximately 1 or 2 months of Lyme infection, is an entirely different story. It's very insidious. It usually involves a triad of fatigue, arthritis, brain fog with very poor memory, confusion, and many times neuropathy, which consists of pains in the arms and the legs. So that's a different story. Not everybody that gets Lyme disease is symptomatic, however. About 15% are silent and have no symptoms at all. So it's important in this endemic area in New England that everybody be screened by their primary care physician for Lyme disease with blood tests.
Okay, so what would be the best way to diagnose Lyme disease?
Well, we rely heavily on blood tests. There are specialty laboratories as well as the standard medical laboratories, but the accuracy is only about 60 or 70% in the standard labs. It's called a Western blot blood test, and it measures antibodies to various bands of the spirochete, the Lyme spirochete that causes the infection. The other way, not everybody is positive, even the specialty labs, which average about 85% accuracy. And many times we treat just with a good, tight clinical fit of symptoms of the ones I mentioned before, if we really are convinced the patient has clinical Lyme disease. And in this part of the world, there are very few other diseases that can generate that spectrum of symptoms that Lyme disease has. So we go ahead and treat anyway, even with negative tests, if we're convinced there's a tight clinical fit and it looks good for Lyme disease.
What do you follow for treatment for Lyme disease?
There are as many Lyme literate physicians as there are as many different treatment approaches. I usually use the standard approach with antibiotics, usually 2, and we can rotate antibiotics eventually after a few months. We also must use supplements to support the body's immune system, the antioxidant pathways, and we also use Chinese herbs and American herbs that are anti-spirochetal that help the antibiotics, as well as recommending later on energy treatments with something called a Rife machine, R-I-F-E, which is a frequency device which helps to kill the Lyme spirochete, as well as ozone, which patients do at home, and they usually consist of doing one of 2 methods of the ozone. Putting all these things together, as well as with a very specialized diet, which is similar to a yeast diet or a candida diet consisting of no sweets, no processed carbohydrates, we usually get very good results. And the more people do, the better and the quicker they recover. We also support many of the systems of the body, including the adrenal glands. We look at these and support these with herbs and sometimes hormones, the thyroid gland, and we look at heavy metal concentrations in the body, and we remove these with special techniques, supplements, after analyzing them. This is important because removing heavy metals frees up the activity of the immune system, which it impairs. And when we do this, often we get a rapid progression in activity and recovering from Lyme disease.
Thank you. Okay, can you tell us what are some preventative approaches that we can take to help against Lyme disease?
Well, as you say, an ounce of prevention is worth a pound of cure, and it's very important. In this area, if you're going to spend any time at all in nature, you ought to use the natural oil sprays that are tick preventative, such as, I'll mention some trade names, Buzz Off, or lemon eucalyptus oil, or a Wilderness Guardians brand of geraniol. These are natural oils that repel the ticks, sprayed on all exposed areas of the body, as well as the interfacing clothes, the hair, and the face. They're non-toxic totally. They do have a smell. The alternative is to use DEET, but DEET should only be sprayed on the clothes because of its toxicity. People should do, after spending some time in nature, walking, hiking, gardening, do tick checks. Take all their clothes off and just rub the entire body looking for attached ticks and remove them very delicately with a specific tick tweezer so that the infection does not take place. If a tick looks swollen and engorged, that means it's fed a blood meal on your body, and there the risk is after 24 hours there could be infection. So it's ideal to do tick checks every time you remove yourself from nature. The other thing is reasonable practices in walking through the woods. Walk in the middle of trails, avoid bushwhacking, cut your lawn so it doesn't grow tall. They like tall grass. They especially like moist, marshy areas by rivers, lakes, and ocean, so avoid those areas. But the tick checks and the sprays are very important. Some people who have lots of ticks in the area that live near very endemic areas, near the South Shore, North Shore, the Cape, have special companies spray their property with tick retardants, such as permethrin or red cedar oil. There's also a method using infested cotton balls to repel the rabbits and the mice so that they don't feed ticks to the deer. These can be bought in local outdoor stores.
Thank you. So if we find a tick on us, is there a way that it can be tested for Lyme disease?
Certainly. You can send a tick to the state infectious disease department, and they will analyze it. It will take a week or two to get the results back. By that time, you should have made a decision early, within a day or so of the tick bite, what to do. We usually recommend 3 days of high-dose antibiotics, different for pregnant women and children than regular adults. But it's important to get this done right away, even before the tick results are back. But yes, the tick results can be seen. They can also be sent to specialty laboratories and the CDC.
Okay. Are there any places viewers can go to get more information, such as websites, or are there groups out there to help them?
The website for ILADS, which is ILADS, which is the largest Lyme support organization in the world, based in the United States, International Lyme and Associated Disease Society, has a large website with lots of information for patients, as well as the CDC. They also post some things, many times repeating what I've said about the preventative practices, wearing long sleeves, long pants, tucking the pants into the socks to avoid skin exposure for the ticks.
Okay. Well, thank you very much, Dr. Gertler, for taking the time out of your busy schedule. We really appreciate it.
Yeah, you're very welcome.
Okay. Thank you, Doctor.
Thank you. Bye. Well, this is the second part of our show, and this is Zach Orme. You all know him. He's been my guest several times on the show. And the reason that I'm actually having Zach on this time is because he actually has Lyme disease, and he's willing to talk about his experience with Lyme disease. So, very glad to see you here again, Zach, with the show. And would you mind if I start asking you some questions?
Please, that'd be great. Yeah, thanks for having me, Margie.
Oh, you're so welcome. So basically, I wanted to find out what your experience is with Lyme disease. And I guess the first question to ask you is, how did you actually know that you had Lyme disease?
Yeah, it's a great question. I was fortunate enough to be one of the, I guess, statistically speaking, less than 10% of people that get bit with a Lyme-carrying tick actually get the bullseye, which is sort of the textbook. If you get the bullseye, you know you have Lyme disease. I was fortunate enough to get the bullseye when I got bit on my left quad, I believe, the summer of 2008. I was down on Martha's Vineyard for the 4th of July, and that's when I got bit. Got back to Burlington, Vermont, where I was living at the time, and noticed that I had this bullseye. I never saw the tick, but seeing the bullseye, you know, I knew that it was Lyme. Went into the student health clinic and got on antibiotics, which was the right antibiotic, but just not a long enough duration of treatment to eradicate it in the window when it's still acute before it becomes chronic. So I got the bullseye. That's how I knew I got bit.
Yeah, kind of scary to think about this, but yeah. Can you actually tell us what your symptoms were? Because I know that sometimes symptoms vary. So could you tell us what yours were?
Yeah, and so, depending on age and every number of varieties, there's all different kinds of symptoms that affect different people. My personal experience with it was more primarily fatigue and just severely depressed immune system. I would just get sick with a cold, and then I wouldn't get better. It would just progress through bronchitis and pneumonia, and I would just be sick for the entire winter. So it was just like my immune system was so bogged down, just trying to stay above water, defending from the Lyme, that anything else that came in, just sort of had its way with me, basically. So, brain fog, fatigue, and a lot of sort of neurological stuff in terms of word recall and memory, depression, all that kind of stuff. Not so much joint issues necessarily, but just kind of definitely some overall aches and fluctuating symptoms in that regard.
Wow. And how long was that going on, these symptoms? How long have you had them, or do you still have them?
Yeah, so I got bit July 4th, 2008, and then I thought at the time that I eradicated it because I got on the antibiotics, and then found out over a year after that it was not a long enough duration of treatment, and it came back and became chronic, or it wasn't enough to kill it initially. Killed the initial symptoms, but didn't kill it off out of my body completely, because the spirochetes, the Lyme, the actual Lyme bacterium, are very effective at, are very skilled at evading antibiotics. So they have different, like when they sense when there's an antibiotic in your system that's attacking them, they can throw a bioshield over them and go into cyst form for up to 2 years, so they can completely evade antibiotics without feeding or anything, and then come back out when the coast is clear, kind of, and just so it killed the initial symptoms and then came back. So I think it was around the summer of 2009 that I realized that I still had it in my system, and then from there it was about a 3-year process of just working from doctor to doctor and researching and finding out as much as I could, things that worked, things that didn't.
So basically, how long did it take you to find a healthcare provider that really helped you? And who was that person, or who are those people?
Yeah. Like I said, it was, I think, about 3 years from the summer of 2009, once I realized I was still dealing with it. Stephen Buhner's book Healing Lyme was kind of on the back burner, and it wasn't really until I found Timothy Scott, who's an herbalist and acupuncturist up in Brattleboro, Vermont. And I just had, I think it was like a 90-minute phone consult with him, something like that. And it was far more reasonably priced and far more educational, productive than, the exorbitant prices I had paid on all the different people I had seen leading up to him. And so he had trained under Stephen Buhner, and he produces the herbal protocol that Stephen Buhner prescribes in Healing Lyme in that book. And so, and he custom tailors the other herbs that complement that protocol specifically to your symptom profile based on, like I was talking about before, the co-infections that show up in, any cocktail of variety. So, had the phone consult with him and learned more, like I said, in that 90 minutes maybe than I had leading up to that point. Got on a protocol, and that was the beginning of a 2-year. So like I was saying, the spirochetes can cyst up and throw a biofilm over them that makes them impermeable to the antibiotics for up to 2 years, supposedly. So I did a full 2-year herbal antibiotic regimen, as talked about in Stephen Buhner's Healing Lyme, through Timothy Scott, working with him. And that really, that was what really brought me back to life.
Wow. Where
I am now in Boston, working with Bob Cooley. So that's sort of been the next stage of the journey, the next chapter for me from that.
Do you feel that that's fantastic? I mean, that you're so lucky that you were able, not real luck, you had to work really hard to find someone to help you. And do you also feel that Bob Cooley helped you a lot with Lyme disease? Tremendously,
yeah. So like I said, that was sort of the next phase of the healing journey for me. The stretching, the holistic view of leveraging the physical world. It's a physical modality of stretching and strengthening the body with specific, specifically focusing on different meridians that correspond with the immune system. And the defense to, like, keeping your defenses up from outside things like ticks getting in and all of that, but primarily the internal immune system, just really boosting that and healing that so that it can essentially, if it is still in my system, just keep it in remission, basically.
Yeah, I'm learning so much about the immune system. It's like you have to have a very strong immune system for any illness.
Especially in this day and age.
Yeah, here I am proponing for everybody to go out there and, go for walks, be out in nature. And then, I started to think about Lyme disease. And now it's kind of like I felt like this was an important show to talk about because people want to be out there and experiencing the beautiful weather. And now we've got Lyme disease. So what would be some of the, helpful approaches that people could use to prevent getting Lyme disease?
Yeah, again, another great question. I really don't think it's a good idea to just stay away from the wild. I think more than ever, we need to rewild ourselves. With the modern urban lifestyle that so many of us are living, I think it's really important to get back into the wild, ground ourselves, everything that comes with that. And there's so much fear, rightfully so, surrounding doing that because of things like Lyme disease, and we're getting more and more distanced from the wild world and the natural world. So I think it's more important than ever, and it's just important to be cognizant of the risks. We don't really have to worry, especially in the Northeast, most of the U.S. really nowadays, as much about predators like wolves and big cats, because we killed them all off. But now we've, that imbalance created other things like Lyme disease. So I think, just the basic things like wearing long pants, tucking your socks into your pants.
What they say to wear light clothing too.
So you can see
the,
right.
So you can see the ticks.
Yeah.
Okay.
So for more contrast, definitely. And it's not always that might not always be the case. It might not always be practical. But just really doing thorough tick checks. If you are going to be in the woods, just making sure you do thorough checks, and as long as you get them, ideally before they bite you. And if they do bite you, a lot of people say that it takes like 24 hours or something for them to infect you, and I don't believe that. I think there's a lot of instances that show otherwise, but I think it's a good idea knowing that the dangers, if you do get bitten, if they do penetrate the skin, just do the antibiotics. A lot of people might tell you otherwise, but that's personally what I would do, just to be on the safe side, because like you said, there's a lot of people that go 10 plus years without ever knowing what's wrong with them, symptoms just escalating, getting misdiagnosed with diagnosing the symptoms rather than the cause, like fibromyalgia, things like that are symptoms of Lyme, and missing the root cause, which oftentimes is Lyme disease and can become debilitating for some. But yeah, just being cognizant, being aware, being as preventative as you can. And also astragalus is a great herb, as Stephen Buhner talks about. The Healing Lyme book is a great resource. Astragalus is a really good herb in the acute phase, but it's contraindicated in the chronic phase because it's an immune modulator. So it's really helpful, preventative in the acute phase, but contraindicated for chronic Lyme.
Okay, that's good to know. I know that there's also Japanese knotweed, not weed.
Yeah.
Yeah, that's supposed to be very effective also.
That's one of the primary herbs that in the Stephen Buhner's protocol to help heal Lyme. And it's interestingly enough also one of Timothy Scott's projects, one of his areas of study. He's written at least one book that I'm aware of in terms of invasive plant medicine. Interestingly enough, what we deem invasive species, Japanese knotweed being one of them, has followed the same vectors spreading through New England as the spread of Lyme disease and the ticks. So it's like, you get the illness spreading with nature's counterpart, what you need to heal it. So it's fascinating. Nature really is fascinating in that way.
That's a really good point, and really good for people to know that nature actually does really want to work with us.
Yeah, exactly.
Rather than against us.
Right.
Yeah, that's wonderful to know. Yeah. Thank you so much, Zach. I mean, that's so important. I mean, and to be able to share your experience the way you have on this very, very controversial subject, too. I mean, it's been hard getting the information. It's been hard getting people that really know about the disease and are willing to talk about it in the way that it should be talked about, in the way that the public needs to know about it. So welcome back to our third segment on Lyme disease. So we've been actually talking about Lyme disease and how it's actually much more pervasive than we think it is, and it's actually spreading, and there's a lot of collusion and probably not getting out all the information that we really need to get out on Lyme disease. So that's why we're here, to talk about it. So I'm just going to help the audience to do some of their own research on Lyme disease and talk, and please add whatever you want on this subject. But there are places that you could go to online, and one of them is the International Lyme and Associated Diseases Society. It's under ilads.org, And you told me about this, that they're having their 17th annual scientific conference November 4th through 6th, and it's in Philadelphia. And they actually have 2 researchers who will be invited to present their own research papers on the recent progress and protocols which benefit diagnosis and treatment of tick-borne illnesses. So that might be a conference either to attend or at least to maybe go on their website and find out what the new information is on this issue.
And if you're looking for a Lyme literate doctor, as they call them, that's a good website. That's a good resource for finding people in that network also.
Good. Oh, good. Thank you. What else? Oh, actually, there are 2 movies out there that you could watch. One of them I know you could watch for free on Hulu.com, and that's Under Our Skin. And that was filmed maybe about 2008. And that's all about Lyme disease. And then in 2000...
It's a great resource. Yeah, that's a really beautifully done piece of journalistic reporting.
And the newer one is also it's called Emergence, and then it's parentheses Under Our Skin 2, so it's the second part of it. And they talk about the medical collusion and conflicts that exist between the holistic model and the medical model, which is so important that we know more about this stuff. The book, by Stephen Harold Buhner. Mm-hmm. He has a book out, and that's called Healing Lyme Disease, and that's the book that you
Healing
used.
Lyme. And I believe there's been updated versions of that book, the most recent of which I believe came out recently. So he's constantly, as far as I know, he's one of the premier global authorities as far as healing Lyme disease. And so that's a great resource, the book Healing Lyme. That helped me tremendously. And Timothy Scott, who produces the protocol that he recommends, he's based out of Brattleboro, Vermont. His practice is called Green Dragon Botanicals. So that's a good one.
And actually his book, I wrote it down because you told me about it, it's called Invasive Plant Medicine.
Yeah.
Yeah, by Timothy Scott.
Fascinating stuff. And also a couple doors down from him, if you're ever in Brattleboro, Vermont, is another great center. It's called the Brattleboro Holistic Health Center. And it's a cooperative establishment with a bunch of different great practitioners under one roof, acupuncture, massage, herbalists, all that kind of stuff. And they also produce herbal medicine. So I know nowadays, because of the demand, oftentimes if Timothy Scott is out of stock in something, they might be another resource to check into in terms of supplementing and piecing together, again, incredibly high quality plant medicine.
Oh, great. That's really good information. I guess that's about it. That's the resources that I have, and I'll be listing them at the end of this segment so that you'll have a list of all of the information that we're talking about. Okay, so once again, Zach, thank you so much for being on the show.
Yeah, thank you for having me, Margie. Always a pleasure.
Thank you.
So when you're going out this morning, I wish you safety in your travels. 'Cause it's the journey, not the destination, that reveals the path. And I'm trying to keep my concentration, cross the territory, not just on the map, 'cause I think that's where it's at.